Hi, I'm Kelly. I'm currently a certified nursing assistant, and I'm very anxious to start my nursing program next spring, so I decided to show an important skill that I will need to perform on a daily basis as a nurse. This skill is checking a patient's blood sugar levels. It is important to check sugar levels because diabetes has become more and more prevalent over the years as the diet and exercise across the world has decreased. I feel it's important to give you guys some background on diabetes so you guys can fully understand why blood glucose monitoring is so important. Diabetes occurs when the body can no longer produce or respond to the hormone insulin significantly enough. Insulin helps glucose get into the cells for energy use. Without significant insulin, blood glucose levels become too high. There are two types of diabetes. Type 1 diabetes occurs when your body does not make insulin, so cells cannot absorb the sugar that you eat. This type is common in childhood. Type 2 diabetes, on the other hand, is the most common and occurs when the body does not make enough insulin. This type usually occurs due to poor diet and exercise. For people with diabetes, the recommended blood sugar levels during fasting is around 80 to 130 milligrams. On the other hand, the recommended level 2 hours after eating is less than 180 milligrams. Now I'm going to show you guys the steps that are involved in taking a sample. The first step to collecting a patient's blood sugar levels is to collect all the necessary equipment that you will need. This involves a test meter, test strips, a finger pricking device, clean gauze, gloves, and the patient's records. You guys can see examples of this on the slide. Next, you should inform the patient on the task that you are performing and how you will do that task. If they agree to it, you are going to perform hand hygiene on both you and the patient. Try to avoid alcohol wipes as these have been shown to interfere with the readings. Once you have done that, turn on the glucose meter and you're going to insert the test strip into the meter. Next, you will remove the cap on the lancet and prick the patient's finger. Inform the patient that there will be a sharp pinch, as some people are afraid of this. Next, you are going to gently squeeze the finger to produce a blood droplet. Bring the tip of the test strip to the blood droplet. After getting a sample, apply gauze to the puncture site to stop the bleeding. The blood glucose meter will show the patient's results. You're going to record these results in the patient records, and if results are not good, perform corrective measures. These are the steps to collecting blood sugar levels, but you might be wondering how often you should check these levels. For patients with type 1 diabetes, you should check their levels 4 to 8 times a day. This occurs before and after meals, before and after exercise, before bed, and even throughout the night, depending on how bad their case is. For patients with type 2 diabetes, you should check their levels around 2 to 3 times a day. This usually occurs before meals, but can also occur after meals or before bedtime. Also, this depends on how bad their case is. The reason checking blood sugar levels is so important is because there can be some major side effects of diabetes. If a person's levels of blood sugar is really high, there can be symptoms that include increased urination, increased thirst, and hunger. It can also cause weight loss and blurry vision and sometimes nerve damage. Low blood sugar, on the other hand, can cause confusion, hunger, a racing pulse, coma, and can even lead to death. I have a quick video that demonstrates the steps that are involved in taking a blood glucose reading. So in this video, the guy is going to ask the patient if it's okay if he takes a blood glucose sample from him. He asks the patient their name and date of birth just to make sure that they are the right patient that needs to be taken a sample from. He explains the procedure to the patient and tells him that they should perform hand hygiene on both him and the patient. These are the equipment that you are going to need. That is the meter, some test strips, that is the lancet to prick the finger, and that is the gauze to stop the bleeding. This is a test strip. He's going to put it into the meter and wait for the go-ahead. Next, he's going to bring the test strip to the patient's finger, and he's going to show you an example of this. He tells the patient that it's going to be a little pinch on his finger. Here he puts the blood droplet into the test strip so that he can get a reading. It takes a couple seconds to get the reading, and in a second it will display the reading that he found, which is 4.5. This reading is different because it was taken in the UK, I believe. He disposes of the gloves and the lancet and thanks the patient for his help. Next, he would record the patient's reading, and if it seems normal, then it's fine. But if there needs to be a corrective measure, he will give them insulin or have them have food if their blood sugar is low. It's important to perform these corrective measures because, as you see, the symptoms are really bad, and if they're not corrected, they can cause death. So it's important to really get them checked and to make sure you're on top of all your stuff. Thank you so much for listening.